So, obviously everyone had to kind of pivot and move folks to work remotely. So we were no different in that. And so while our caregivers are still working primarily remotely, particularly in our inpatient working in the hospital in our inpatient settings, some of the things we've had to do, with care managers who are doing a lot of care coordination who are generally on site, we've moved them remote, but the tools that they have access to are really designed that where they can work anywhere, anytime, anywhere. So that's been a really important for us. I think, education campaigns, people were concerned about coming into healthcare facilities. Our pediatric patients were no different. And so we had to uh, implement different strategies, whether it's billboard campaigns, supporting how safe it is, and then the protocols. We want you to come in. Whether it was outreach, whether it's digital outreach, text message, email outreach, to really reinforce that it's safe for you to come in. We need you and we want you to come in, particularly if you think about uh, immunizations. If you're not coming in for your immunizations, then you can really create a scenario where you're more susceptible. So we're already in a pandemic, and there was no vaccine at the time. But if you're off your immunization uh, regimen, then you put yourselves at more risk. And so we wanted to minimize that. So tons of education and outreach with our primary care network. They did a phenomenal job with that. I think some of the other things, continue to focus on digital and our patient experience. We were invested in a strategy to improve that inpatient experience through digital technologies, and we tried to accelerate that through the pandemic. And that's all about mobile. Everyone wants to be reached through a mobile device. We have a lot of millennial parents, a lot of Gen X, and they do everything through their mobile, smartphone, or iPad. And so the technologies that we're introducing are really designed to meet them where they are. And so we're excited about getting those things going and getting pre-visit questionnaires and forms. How much can you do before you come in? So you limit the amount of time in the facility, and you get there and you can be seen by your provider. And the visit can really be focused on the care and not you filling out a clipboard forms that you filled out probably 1,000 times before, if it's not your first visit. So really wanting to minimize those types of things and make it really seamless and frictionless for our patients, patient families.